Hello dear students, today's topic is topographic anatomy of thorax. In general, thorax is the part of the body between the neck and the abdomen. The borders of the thorax are: the superior border runs along the edge of the jugular notch of the sternum, clavicle, and further along the line of the acromioclavicular joint to the apex of the spinous process of the seventh cervical vertebra. The inferior border runs from the base of the xiphoid process of the sternum along the edges of the costal arches, the anterior ends of the 11th, 12th ribs, and further along the lower edge of the 12th rib to the spinous process of the 12th thoracic vertebra. General bone structures of the chest are sternum, 12 pair of ribs, and thoracic spine. Let's talk about projection lines of the chest. First is the anterior median, which passes through the middle of the sternum. Second is sternal, which runs along the outer edge of the sternum. Next is paramedian, located in the middle of the distance between the sternal and midclavicular lines. And next is midclavicular line. Other chest lines are anterior axillary, middle axillary, posterior axillary. The anterior axillary runs along the anterior edge of the axilla, posterior axillary runs along the posterior edge of the axilla, and the middle axillary passes respectively between these two lines. The next line is the scapular line, which runs through the lower corner of the scapula. Next we have paravertebral line, which runs in the middle of the distance between the vertebral and scapular lines. And next is the posterior midline along the spinous process of the thoracic vertebrae. Now we divide the anterior and posterior thorax into following areas. Anterior thorax is divided into 5 areas: prethoracic, right thoracic, left thoracic, right subthoracic, and left subthoracic. The posterior part is divided into vertebral, left and right scapula, left subscapularis, and right subscapularis. Now let's talk about thoracic cavity. The anterior border of the thoracic cavity is sternum. Posterior border is the vertebral column. Inferior border is a diaphragm. And from the inside there is a pleura, and also lined with the intrathoracic fascia. Mammary gland. The mammary gland is the largest, most complex alveolar tubular gland in the body. In women, it is located between the 3rd and 4th intercostal spaces. The layers of the mammary gland are skin, subcutaneous tissue, superficial fascia, deep fascia, the subcutaneous fat. The subcutaneous fat is not well developed near the areola. Also in the mammary gland, cellular spaces are divided into premammary, intramammary, and retromammary spaces. Now let's focus on the blood supply of the breast. Breast is supplied by intrathoracic artery, lateral thoracic artery, superior thoracic artery, and posterior intercostal arteries. Next is the innervation of the breast. Mammary gland is innervated by branches of the intercostal nerves 1 to 5, subclavian nerve, anterior pectoral nerve, sympathetic nerve fibers. Lymphatic drainage of the mammary gland. The mammary gland is divided into 4 quadrants: superior lateral, superior medial, inferior lateral, and inferior medial. Lymphatic drainage of the superior lateral quadrant is thoracic lymph nodes, subscapular lymph nodes, axillary lymph nodes, central lymph nodes, interthoracic and subclavian lymph nodes. Now the lymphatic drainage of the superior medial quadrant. Paramammary lymph nodes, they in turn drain into the supraclavicular, adjacent and from below to the lymph nodes of the diaphragm. And the inferior quadrant drains to the axillary lymph nodes. Now we talk about the muscles of the thorax. They are divided into superficial and deep. Superficial pectoral muscles, we have pectoralis minor, pectoralis major, subclavian, serratus anterior, latissimus dorsi, and trapezius muscles. Deep pectoral muscles. Are external intercostal, internal intercostal, subcostal, transversalis, posterior, superior and inferior serratus. Next we'll talk about intercostal space. Intercostal space is space between two ribs, is limited by the external intercostal muscles, made by a layer of loose tissue, in which the intercostal vessels and nerves pass. The vessels pass through the lower edge of the ribs, they pass through their own groove. The nerves are located below them. In practice, when we perform the puncture, we respectively do it between two ribs, that is through the upper edge and the lower edge of the rib, because the area is safe. Pleura. The pleura is a thin serous membrane. It is classified into parietal and visceral pleuras. The visceral layer envelops the lung tissue. The parietal layer covers the inner surface of the chest cavity walls. The parietal layer is divided into costal, diaphragmatic, and mediastinal. The mediastinal parietal layer is united with the pericardium of the heart. Visceral and parietal layers are found at the root of the lungs, where the pulmonary vein and the pulmonary ligament are formed. Apex of the pleura is located 1.52 cm above the clavicle and contains subclavian and artery and vein. Next is the pleural cavity. Pleural cavity contains fluid, and the fluid helps to reduce friction between parietal and visceral layers. There are also sinuses in the pleural cavity, and sinuses are formed when the parietal pleura passes from one place to another. So there are three sinuses: costophrenic, diaphragmatic mediastinal, and costal mediastinal. Now we move on to mediastinum. Lateral border of the mediastinum is pleura. Anterior border of the mediastinum is sternum. Posterior is the spinal column, and inferior is the diaphragm. The classification. By anatomical or Parisian classification, we have superior and inferior mediastinum. The inferior mediastinum in turn divides into anterior, medial, and posterior. The line at the level of the sternal angle and the fourth and fifth thoracic vertebrae separates the superior and inferior mediastinum. According to the clinical or basal classification, mediastinum classified into anterior and posterior. anterior mediastinum contains the heart, pericardium, aortic arch, thymus, phrenic nerves, phrenic pericardial and internal thoracic arteries and veins, pericardium, mediastinal phrenic lymph nodes. The posterior mediastinum contains the pharynx, thoracic part of the aorta, thoracic lymphatic drainage, azygous and semi-azygous veins, the sympathetic trunk, and posterior mediastinal nerve. Now we move to operational accesses. The first axis is the anterior lateral intercostal axis. So there are two ways: through the incision of the wall cartilage, and the second is without dissection of the cartilage of the wall. Next is the lateral intercostal incision, posterior lateral axis. Also we have central sternotomy, incision through the horizontal sternotomy, thoracosternotomy according to Cocker's, axillary thoracotomy, and the accesses in the neck have incision through the jugular opening, incision through the lateral neck, incision through the lateral neck with a transition to the right intercostal space. Thank you for attention.